Diversity champion, I got it. Eyecare legend, I got it. Tune in today as we go deep and live with the one and only Dr. Beverly Bianes. Tune in. Let's go. This is a Defocus Media production.
Audio Jungle.
What's up, everyone? It's your favorite optometrist, Dr. Daryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus. What's up, everyone? It's your favorite optometrist, Dr. Daryl Glover. Happy Monday. Super excited today because we have a true star, a true legend, a true game changer, a true award winner. I mean, the list could go on and on, but I don't want to brag. I don't want to talk about her. I want her to do her own talking today. Friends and family, I'd like to welcome our colleague, the rock star herself, Dr. Beverly. How are you doing today?
I am doing great. Wow, what a great introduction, Dr. Glover. You're definitely my favorite optometrist behind my husband, my daughter, and my son-in-law, but definitely one of my favorites.
Well, thank you so much. And thank you so much for being on the show today. This is truly an honor. I've had the opportunity to watch your career over the last couple of years, and I'm just blown away by just the impact that you have made in the eye care industry. So when you agreed to come on the show, it really touched my heart. I told a lot of my listeners and followers and colleagues, and they were super excited, especially my women followers, because they have seen you do so much in the industry and shape and mold the industry to create a pathway for them as well. And today I'm super excited because we get to tell your story and we get to talk about something that's real near and dear to my heart, along as well as yours, and that's diversity. Diversity is our strength. So I really want to dive deep into that. But before we dive into that, we have to learn a little bit more about yourself. So if you don't mind, maybe sharing a little bit about your background, where you're from, and how you got into this beautiful profession of optometry.
Of course, Dr. Glover. Let me tell you, I am definitely a Dr. Glover defocus media junkie. And 2020, I always listen to you almost every day as we were taking our break through the pandemic. But so thank you. It's exciting to be on this podcast. So a little bit about myself and my background. My parents are Filipino immigrants. My dad told us a story that he had to go in and take a test. And hundreds of sailors are actually men from the Philippines took this test. And he was one of 8 that got accepted into the Navy. And he would talk about how he did really well in school. But when he joined the Navy, it was a great opportunity for him, but he was only able to go into the kitchen and be a cook.
Okay.
Which is something he's still very proud of. You know, he filled the ranks all the way up to senior chief at the end of his career. But, you know, it was not until my son did a little interview on him as a veterans kind of report, and he started talking about his career. And he teared up because he said he was so grateful to have joined the Navy, to be able to give his kids an opportunity to have an education. And he has now an engineer, a lawyer, and myself, a doctor.
Wow.
So, yeah, so I have to give kudos to my dad and much gratitude for my parents. And so I grew up in South San Diego, which is a city called South Bay. It's like 5 miles away from the Mexican border.
Okay.
And yeah, and I grew up I'm only going to say this because we're going to talk about diversity later on. I grew up in a Title I high school, and then I attended UCSD, and then I went to optometry school, which was Southern California College of Optometry, where I married my optometry sweetheart, Dr. John Pack. And how did I get into optometry was coming from a Filipino family. They pick your profession already. You either have to be in healthcare, you have to be a lawyer, an engineer, or in some sort of education, right?
That sounds like an African background or an African family as well. It's the same thing. Yeah. I know that language.
I'm sure that's also with Hispanics as well. So all of my aunts were nurses. So I said, oh, I want to be a nurse. But it was one of my favorite aunts who was an RN. She goes, "No, you're not going to be a nurse. You're going to be a doctor." And I said, "I don't know if I want to be an MD." So it was not until I got fit into my contact lenses, my first time in contact lenses, that changed my whole experience to eye care. I was an Asian, a quiet Asian girl that just was sitting always in the front seat because I couldn't see and I was embarrassed to wear these big clunky glasses. Something my mom picked out, probably because it was on sale or is what she can afford. So I didn't want to put those on. So I sat in the front seat. So the contact, being fitted into the contact lenses, gave me confidence and made me start to put myself out there, ran for president and was on the cheerleading team. So it really impacted my life. And so this is when I said, that's what I want to be. I want to be an optometrist, to impact people's lives and to provide vision for them. So that's a little bit of my background.
I love it. Incredible background, incredible story, and shout out to your dad for just being the man, right?
Yes.
I'm curious to know, how does that immigrant background help to shape and mold your story? How does it, give you the motivation and the determination to make the impact that you've made? Because I'm pretty sure, that background, that family upbringing, that journey has really made a difference in regards to how you see patients, but also how you lead in the eye care industry as well.
Yeah, it did make a big difference. I saw my dad work tireless. My mom was also a dentist in the Philippines, but when she came to the United States, she couldn't practice to her full extent. So she had to take several tests to actually become a dentist in the United States.
Yeah.
So each time they came home, they worked really hard, came home, and we basically had to kind of fend for ourselves. They just basically came home and said, "Did you do well in school? Did you, are you ready to apply for colleges?" I mean, they didn't know how to get us into college. So that really impacts me today. That's why I'm very passionate about trying to give back to communities like Title I schools that, maybe don't have that mentorship, and that guidance. So that's where that comes from, where that's important for me to actually give back in that way. And then just them, always being there and supporting us in whatever we chose. So that really is what really impacted me.
Yeah. And you see, when I hear that, I take a couple of core values out of what you just delivered, right? I take, one of the core values in your family was clearly education, right?
Right.
Your parents really pushed that. They wanted to make sure you had everything to be successful, but they said
Mhm.
education, education, education is key, right? And the other thing is the importance of family, right? I mean, this
Mhm.
whole story started off with you talking about your dad and then into your mom, and then you even touched on your family, right? Your
Right.
husband, Dr. Pack, and then your two children or your children as well. So, I can clearly see that your upbringing, those core values was definitely family and education.
Right.
Now, I want to spend a little time on family because when I saw you last, I think it might have been Vision Expo East.
Yes.
Not only did I see you and your husband, which I already knew were ODs, there were two other ODs that were part of the family. So if you don't mind maybe breaking that down, because you guys over there almost have like an entire lineup for a basketball team when it comes to eye doctors. So we got to talk about
Almost.
this a little bit more, if you don't mind.
Yeah, no. Yeah, my daughter, as we're growing up, when she was born, I always try to expose her to the field of optometry. So I would bring her to our office and sit her in when she's an infant in our chairs. And, she was always there with us. And everything I did was trying to actually teach her the vocabulary of optometry. So I would sit her on the sink with me as I put on my contacts, and I would put my little contact on my finger and tell her, "Contact, contact," so, to try to get her to repeat me. So I knew she was listening to me because one day, I think she was 2, and she found a sequence on the floor that looked like a contact, and she put it on her finger. She goes, "Mommy, contact." And I go, "No, no,
Oh,
no, that's
wow.
not a contact." But That's what it is, right? That's why we're talking about Title I schools, is that we need to start like educating these kids early on about the vocabulary of different professions and things like that. So I knew she wanted to be, I knew she was going to be an optometrist. So, however, as she was starting to grow up, she wanted to do nothing like what her parents are doing. So she talked about other careers as she was going through high school and in college. She at one point wanted to be in archaeology. That changed when my husband goes, "Go dig outside with this shovel in the hot heat," and she's, "Oh no, I don't want to be that." But yeah, so that's how that all started. And when at UC Irvine, when she said, "Mom, I think I want to be an optometrist," and I said, "Wow!" She told us she wanted to be an optometrist, so we were happy about that. We do have a son who just graduated from Berkeley. He's applying for a medical school at this point. He said he didn't want to do anything with eyes, but so funny, during his post-bac, he worked at an ophthalmology office. Now he's actually pre-testing and opticianry at my daughter and son-in-law's practice. So we definitely have a family that talks about optometry, eyes all day. So fun, and it's supportive again as family, but we do talk about other things that are fun too. So
Yeah, I was gonna ask, how was dinner, right? What kind of conversation do you have at the dinner table? Are you talking about retinal detachments, or are you talking about going out on the weekend and having a good time? I mean, where do you draw the line?
sometimes it is maybe the whole dinner might be about a difficult patient. How could you have handled that? What do you think this is? Until my son, who says, "Okay, this is enough about eyes. What about our food? Let's talk about food and where our next vacation is." So, yeah.
Wow.
So
Well,
yeah, we
I
get
love
the
it.
support from each other, which is really cool. So.
That's huge. That's huge. It's always great to have great support. Also huge to have great mentorship. What I would like to kind of pivot to is really kind of gear this conversation towards diversity. And I really
Mhm.
want to touch on two buckets. Number one, the importance of mentorship when it comes to women, the OWA in particular, because recently this year, I know you won an amazing award. So I'd love to touch on that. But then also, I want to talk about some of the diversity initiatives that you have going on in California and San Diego in particular. So let's kind of start with the OWA. How did you get involved with this organization? And how has this organization helped you personally and also professionally, if you don't mind sharing?
Yeah, OWA is definitely dear to my heart. Like it just came at a perfect time for me. It was a transitional time in my life. And I was introduced to OWA, I think, in 2019 by President Deb Vulcan. And she just talked about it briefly, but invited me to go to Vision Expo West to their meeting. And I went home and Googled um, Optical Women's Association. As an optometrist, I never heard about this organization. So I Googled it, and basically I really liked what it stood for. It was about women, supporting women through networking, education, and peer support. And I thought I really, really wanted that. Like I think I needed that at the moment, because being in your private practice for a long time, you never get exposed to different types of leaders. And then I had a little different experience with a leader. So I just wanted to find someone else, see what the whole industry was all about. And I was really just amazed by the women I met and was introduced about. Because who they were, for one thing, how they got there, and what they stood for, which was like in their story and their journey, was really amazing. And what I really admired even more is that they were willing to support me and actually, really work with me. So personally, OWA in 2020 was just definitely a place where I had a space to really find out who I was. And I realized after being in private practice for 30 years is that I really enjoy creating things. I really enjoy creating and building things from ground up and seeing where I can make a difference. So I knew my happiness was in connecting and relationships. So that's what I really enjoyed about OWA. And I was able to bring some projects over. One was a coffee break, connecting one sip at a time. The second one that I was really happy about and proud of was Food for Thought, where food breaks down barriers and brings us all to the table.
Oh, I love that. I
Yeah,
love that.
so that one was a diversity one because, with the big ordeal with watching someone die on national television, like your heart breaks, right? Like
Yeah.
we all have differences, but what can we bring through a commonality is food, where we can talk about our culture, our traditions behind food. And that just kind of breaks things out. Like, you know, just sitting across the table with dinner, how can you not feel some sort of fellowship with one another, right? So that's what it was. It was videos of people talking about their culture. So that
It's funny you mentioned that. I want to spend a little time there because in my office, in my exam lane, the one thing that I always talk about is food. Now, yes, I'm a foodie, but to your point, like for me, it helps to break down barriers with my patients, right? It allows you
Mhm.
to get that trust factor and you learn so much about someone's background. For example, your background, you're Filipino, right? We
Right.
can start having a conversation. And I know when I was in optometry school, one of my best friends in optometry school was Filipino, and him and his wife would always cook adobo, and they would always say, "Whose is the best?" Right? So having that experience through food and that culture, when I have a patient in my exam lane, I'm able to connect with them by just bringing up that conversation, bringing up that food, and talking about my experience and how much it excited my taste buds. Right? But to your point, again, food can really elevate a conversation, create trust, but really make that doctor patient relationship very strong.
Yes, yes. I remember being exposed to sushi at a really young age, like 10 or 14, because of my Japanese friend. And she was kind of invited us over for sushi when it wasn't in vogue back then. And I just remember just watching her. And at that age, I knew that was special. Like I
Mm.
was coming into her world and being introduced to her culture. So I thought that was really special. So, yeah. So that was one of those things that I did for OWA. And professionally, it just opened up a lot of opportunities for me. Getting to meet some, you know, amazing women there pushed me to do things that I never would have done, like podcasts like this. I was always fearful of those things. And so it really pushed me to have confidence in myself. So
Yeah.
professionally that way as well.
Well, I had a guest on earlier this year, from the OWA, and I was telling her that I had the opportunity to actually attend the breakfast at Vision Expo East, and just the energy, the speeches given by the award winners, all three of you ladies just really touched my heart. I mean, the stories were so powerful; they just connected. It made you think. It made you want to do more. So I just take my hat off to you, Talia, the other winner, and just the entire OWA, because you are making a change, you are making an impact, and that's what it's all about at the end of the day. What are we doing to create, family, community, and eye care, and what are we doing to create effective change in the eye care industry, but also most importantly with our patients? How are we helping our patients? How are we allowing them to live their best lives? And that organization truly embodies that, and I love what they're doing. Um, I want
Yeah.
to kind of switch gears here and I want to talk about what you're doing in San Diego because it's game changing. I don't think I've ever seen anyone doing some of the things that you're doing out there. And I would really love for you to take it from the top and kind of just walk us through this path of where we're going with this initiative that you have. So if you don't mind, just really painting the picture because I want everyone to see it and hear it. And I want them to understand it so we could take this project, this initiative that you have, and start to implement it in different states and cities as well, because you have something on your hands here, my friend.
Yes, so excited about this. As I took on the leadership of being president of the society this year, each president usually has some sort of vision on what kind of initiative they want to do, what kind of project they want to focus on for the year. And I was inspired by your organization, Black Eye Care Perspectives, and I like your vision and your where you were going with that is just changing the the outcome of optometry about
Thank you.
1% of the time. So that's what inspired me. And I wanted to focus on diversity. I don't know if you've ever been in San Diego, we have extremes of really poor areas and very rich areas, but I grew up in the area where all the Title I schools were, where there is historically marginalized communities that don't get exposed to a lot of different things. So first of all, we started off with just doing PowerPoint presentations, like at Title I schools. And so I was trying to get openings into some private, Title I schools. And so I came across Assistant Superintendent Matthew Tissier, and he says, I have something bigger for you. And I said, wow, what's bigger? And he said, well, in 2020, our San Diego County Office of Education was able to purchase a building from a charter school that actually closed down. So they bought that building. So he had me come down, and basically he was saying that I would love to have this classroom dedicated to the profession of optometry. And his vision was to actually have a student come in there and see all different aspects of optometry. So going from front desk to billing, to being in the boutique, to the lab, to the office, to being the doctor of the office, and then just showing lab work as well. So these were things that we are looking at putting together so that we can expose this, like I said, expose these children to the vocabulary of optometry and see what is something they can inspire to be. So,
I love that. And I think we got to spend a little time on that. What you just described was truly the patient journey,
mm-hmm,
right? And it's awesome that you're bringing this to the forefront, right? As a student that's trying to figure out this profession or learn more about this profession, not only are they going to see the journey from the patient's perspective, but they're going to see it from the doctor's perspective so
right,
that they can see what a doctor does and the impact that they have on the patient, right? But also experience it as a patient because they may have never even ever had an eye exam, right? So to see the
right,
importance of getting an eye exam as well. And you're doing it in these communities that need that hope, that need that assistance. But most importantly, you're tapping into a market that's not been tapped into. When it comes to optometry school, a lot of times these schools pull from the same bucket year in and year out, right? But now we're giving exposure to this amazing profession to a whole new demographic, a whole new face that can come in and help solve the problem of needing more ODs, right? I mean, that's
right.
what we need at the end of the day. We got to stop going through the traditional ways of how we do things and really branch out and change how we do things. That way we can have more optometrists to handle all the patient load that's coming. I mean, it's an aging population that's out there.
Yes.
We got to be able to take care of that. But you're getting me excited here. I'm gonna stop talking. I'm gonna let you continue with this journey that you were sharing.
It is exciting. I mean, the assistant superintendent, Matthew, has such a great vision. He says we really need to start talking about different careers earlier, not when we get to high school, not when we're in college, but earlier, because like I said, sometimes you're just pigeonholed in certain careers in certain communities. Like you're only able to do this kind of careers. So exposing them to different careers and different ideas needs to start early. So I'm glad we're going to be starting like earlier, like fourth grade. So we have almost like 500,000 students can be exposed to this classroom.
Wow.
So his idea is that these schools come in 1 week to span different days in different classrooms, like the optometry classroom, the engineering classrooms, and all these other different classrooms. So I'm just really excited that he was able to choose us as a profession. So I've already got like SCCO that's going to be donating a chair, a phoropter, and a slit lamp. And this is my, vision is that a child can put on a white coat and we can give them ideas of how to take a case history and kind of do some role playing. So we have that interactive. We have people like Nerlin said they would donate prisms so they can see how light comes in and bends the light. So all these different things that we are going to try to expose the kids to. So we're going to try to get optometry school students, pre-optometry school students to come in to actually help out. There's going to be an actually assigned teacher to the classroom. So
Nice.
this is exactly, I'm so excited about this. I can just see a big impact this would have in the community. And some of the other ideas is we're going to have like pictures of like me, or we can even have a picture of you, and they push my QR code and say, "Hi, I'm Dr. Glover. This is what I do for the day." And so it talks about the profession. So this wall will have different murals of all these different pictures of people in the industry to talk about their profession. Like, do they know vision therapy, about vision therapy, sports vision?
Yeah.
So they don't have to go to the office. They're going to just come to this classroom and be able to see everything.
Yeah, that's a game changer there. QR codes have changed the game, and you can actually bring your energy, your story to someone anywhere in the world. So I love that concept. Count me in. I can see how there's some overlap with that in Black Eye Care perspective. We got to work together if we're going to make a change. So I'm all about that. Now, I want to call out some companies here. You mentioned phoropters, slit lamps, all those things, right? Well, we
Yeah.
got a lot of great partners out there. Your Johnson and Johnson Visions, they're doing some amazing things. Your EssilorLuxotticas, your My Eye Doctors, your Warby Parkers, your NVIs, your Bausch and Lombs, your Cooper Visions, your all these companies out there. Let's
I
work together. Let's get with Dr. Beverly and let's make the magic happen. Let's support this and see what we can do to push this profession forward.
I
Because
would
at the end of
love
the
that.
day, we need more optometrists, but everyone wins because if we have more optometrists, guess what? All these vendors, they grow as well. So it's a win-win situation for everyone, but most importantly, it's a win situation for the patients. Because again, at the end of the day, we always got to circle back. Why are we doing this? And the
Right.
reason why we are doing this is because we have to serve the aging population. We do not have enough optometrists out there to serve everyone. And there's damn sure not enough ophthalmologists out there to serve everyone. But we as optometrists can really take it to the next level. But we got to work together as a team, as a community, and as a family. So all my vendor partners out there that are listening, transitions as well, because they're doing some incredible things also. Let's partner with Dr. Beverly. Let's make it happen. Jump in her DM, send her that message, get her the
Yes,
tools and
please.
resources that she need to be successful. TopCon, whoever, all y'all companies out there, let's work together and let's make this change. All right, because we need this and we want to continue to see this amazing profession grow. And we can't do it without you.
Yes. Thank you. Yes. I am calling you guys all out. I'm out to help because, but it'll be great to show the progress and how it's moving along. So
Absolutely.
I'd love for you guys
Absolutely.
to follow that, and you guys could have something to be very proud about. So
Yeah. Yeah.
vendors, come forward. Yes.
Yeah. So this is great. I definitely want to continue to track the progress of how this is going to, shape and mold into something amazing. So let's definitely continue the dialogue. Maybe we can get you back at a later date to talk about the updates, and we can call out more companies out there. I'm pretty sure there's more that I'm forgetting about, but no worries, we'll make it happen. But before you go, I really have to ask you for advice, right? There's a lot of young eye care professionals out there that are graduating. And if you could give your new graduate self some type of advice, what would it be?
I recently read this book that it's kind of a little bit strange. Like, how do you live your life intentionally in your fourth quarter? That's where I am, my fourth year quarter in my profession. And I wish I knew this a little bit earlier. Is, basically say yes in your early days. Say yes to things that make you feel uncomfortable, where you can grow. Know your inner strengths. I'm finding my inner strength is through connections and relationships and just creating things. And then third is like forgive. You need to forgive some people that may have rejected you. Maybe forgive yourself for making mistakes, but getting up and doing it again. And fourthly is just be where you are today and just make the fullest amount, fullest potential what you can do. So that's one of those things. And diversify. Last thing is diversify. As an optometrist, we tend to like to be around people that we're comfortable with, other optometrists, but diversify yourself. Be in the industry. We're all in the same space where we're creating things to serve our patients to the best of ability through technology and service. So those are my advice.
I love it. Fantastic advice. And I want to give a shout out to Warren. Warren works for Hoya. He says, we hear you. So Warren,
thank you, Warren.
we got to connect offline. Thank you for always tuning in and supporting the show. And then also he's stating here, thanks for sharing. Both of you are inspirational leaders to our industry. We are lucky to have you out in front. We are in good hands. And likewise to you, my friend. It was great seeing you down at the National Optometric Association meeting. I'm glad that you're down there supporting. Glad everything that you do in this industry, because we know that your mind, man, it's a special thing, and the way you think is completely out of the box, and that's what we need in eye care. We need out of the box thinkers. So thank you so much, Warren.
Thank you. I love Warren. He's been one of those people that pushed me to think unconventionally. So
yeah, for sure. Well, hey, this has been a fantastic podcast. For those that may want to connect with you, that may want to donate, that may want to help push that vision forward that you and your team over in San Diego have going on, what's the best way for them to contact you?
You can contact me, direct message me through LinkedIn. I'm always on LinkedIn, or you can actually email me. It's really simple, drbianes@gmail.com. We'd love to hear from you, and if you have any other ideas, we would love that as well. So
I love it. Dr. Bianes, thank you so much for being on this show. It's clear that education is in your DNA. And throughout your entire career, you have always educated the folks around you, whether it was your daughter picking up that contact lens, whether it was your son going off to optometry school, whether it was working with the San Diego Optometric Society and bringing together students to go in and explore or experience that patient journey. You have always pushed education in this industry, and that's why you are truly a legend, a living legend in this eye care industry.
Wow.
And that's why we truly appreciate everything that you do. And I'm gonna do my part when it comes to pushing more diversity in this optometric community. And I hope and I pray that all our colleagues out there will do the same. Together as a family, together as a community, together as one, we can change the healthcare system forever. So thank you again so much. It's your favorite optometrist, Dr. Daryl Glover. Stay healthy, stay positive, stay blessed. And until next time, peace.
Thank you.
All right, colleagues, and it's a wrap. Thank you dearly for hanging out with the D-Focus Media team. We hope truly something resonated with you. And if it did, be sure to give us 5 stars and make sure you follow us on all social media platforms: Facebook, Instagram, Twitter, LinkedIn, you named it. And our handle is at D-Focus Media on all platforms. And until next time, be sure to keep it 2020, and we look forward to seeing you on the next episode.